Does reparative therapy really work? Well, you've heard from both sides of this equation, from men who have gone through it. Now let's hear from the experts. Dr. Julie Hamilton is a licensed marriage and family therapist and the former president of the National Association for Research and Therapy of Homosexuality. It's otherwise known as NARTH. She says reparative therapy works. And Dr. John Sharp is a leading psychiatrist and a faculty member at Harvard who says reparative therapy needs to be banned. So I know you were watching the show earlier, and Peter and Gabriel are sitting in the audience now. Now, they both argued that they went through reparative therapy. It did not work for them. In fact, they argued that it harmed them.
Yes.
So how do you explain to them, how do you justify to them the pain that they went through?
Right. Well, first of all, I just want to say I'm so sorry for the terrible experiences that you had. The suicide rates and the depression rates within the homosexual population are sadly very high, very, very high. Now, some people say that's because we live in a homophobic culture.
It's because of the kind of work that you do
Yes.
and espouse.
Okay.
Do you understand that?
Okay. Well,
do you understand that?
Okay. Yeah. So I'm sorry that you feel that way, but let me say
It's
that.
not what I feel. What I feel is I feel frustrated that you're telling these stories.
Okay.
What I think is that there's a direct correlation between high rates of suicide in gay folks and the very work that you espouse.
Okay.
So if there's someone sitting at home right now who, for whatever reason, is not happy that they're gay, and they have, maybe gotten pressure from outside, and they're trying to make a decision based on this show, if they should go see someone like Chris and get therapy.
I
got to give them advice, and that's our obligation now.
Yeah, my advice clearly is don't. Don't go see a reparative therapist, with all due respect, because I believe that reparative therapists have an agenda which they put ahead of the patients. So when a patient comes to see me, let's say they've got conflicted issues in their life. Everybody, who doesn't have conflicted issues in their life? I'm interested in exploring those issues and helping a person discover what's in their psyche, to disentangle the threads, to help somebody lead a whole life that they feel comfortable with. Your therapies have this idea of lines are crossed, and there's something about got sexualized from a male figure or not enough of a male figure. Very simplistic notions that don't stem from the patient in front of you, stem from your preconceived ideas. That's anathema to the American Psychiatric Association, the American Psychological Association. I could go on and on.
So if someone wanted to change how they felt towards the opposite sex, is it possible that could happen with the therapy, the safe version of what I'm hearing about today? Or is this something that we should just knock out and get out of people's minds because it's harmful to them?
People don't change. We tried to change people's marriages.
Trust me, I know.
I'm living proof. I have 2 kids. I have a wife. I changed.
Don't know what
you're ignoring
your change,
the research.
No, sir. I don't know what your change means. For example, many people who go... Let me just say, many people who go through reparative therapy, they change in the sense of suppressing some urges or what they're willing to act on. They change in the sense of becoming less sexual. This is not the kind of healthy change that I would want to see in my patients.
That's incredibly offensive to people like me. That's incredibly offensive.
In the literature that this is actually some of the outcomes. There's a lot of harm in reparative therapy. It's not a benign procedure. It's not something we can casually just not notice is going on in the room next door. People get depressed, anxious, suicidal.
Dr. Sharp, if you look at these organizations over the last 20 years, Mehmet, you see a rotation of former leadership who have come out and said, actually, you know what, it doesn't work, I'm gay again. And so there's a rich history in this culture of change that tells us it really doesn't work.
We're going to continue the discussion, more to talk about. We'll be right back.
And that's the basis of reparative therapy, and that's why it's dangerous and wrong.
Okay, and there are thousands of success
That's why it's rejected as unethical for minors by all mainstream medical and psychological
Dr. Sharp,
No, it
your
really
thoughts,
hasn't.
and then
It hasn't been deemed unethical by the associations. The lawmakers are going to deem it illegal in California.
it has not been deemed. Every major association
they have
has
not
deemed
deemed
it
it unethical.
Let me get Dr. Sharp. Patient has been waiting. Go ahead, sir.
Thanks. I just want to say that if a patient comes to me and says, I want to get some change accomplished, or I'm confused about my sexuality or any other topic, I have to make a competent assessment of the situation. You can't just go ahead and, if someone comes to you, Dr. Ross, says, I need surgery, go ahead and provide the surgery. You have to figure out yourself what's wrong. And you have to help the patient understand that. You have to put that in useful terms, and you have to make sure that no one gets hurt in the process. I don't see reparative therapy as doing that.
We'll be right back. I got my final thoughts and some advice on who you can turn to for more information. That's next.